Magandang araw sa inyong lahat, mga future midwives at nurses. Alam kong gigil na kayo para makuha ang inyong mga pinapangarap na lisensya. Ako nga pala si Sir Jeffley, isang nurse midwife at clinical nurse educator, at tutulungan ko kayo para mas lalo nyo pang maintindihan ang mga common concepts ng nursing at midwifery board examinations. Kayo kung naghahanap ka ng video na pwede mong panoorin or pakinggan habang naghahanda ka sa inyong examination, nasa tamang channel ka. Kaya naman huwag kalimutang mag-subscribe, mag-like at i-click ang notification bell icon para updated ka sa mga bagong recorded review na aking i-upload. Kaya simulan na natin ang review. Tara! Mga nurses at midwives, sa video na ito ay pag-aaralan natin at i-review ang mga normal at abnormal structures and assessment findings na makikita natin sa chest, abdomen at ano-genital area ng mga neonates o mga bagong panganak na sanggol. Lagi niyong tatandaan na kailangan nating malaman ang mga normal assessment findings sa ating mga pasyente para mabilis nating ma-point out ang mga abnormal at reportable findings sa ating mga doktor. Kaya naman, ilabas na ang inyong mga ballpens, notebooks, pati na rin ang inyong mga headsets para makasabay kayo sa ating review. Simulan na natin! Now let's also study the chest of the neonate. So the chest of the neonate should be symmetric. So kung ano yung itsura po or movement ng one side, it should also be reflected on the other. So that's what we call symmetrical chest. Now, when we see lumps on the clavicle, it may be indicative of fracture during delivery. So pag nakikita po natin ng lumps dito sa may kwelyo ng bata, especially on the bones here, ang tawag po natin dito is the clavicle. So if we see lumps on this part, it may mean that there was a clavicular fracture during delivery. Now, the normal respiratory rate of the newborn should be 30 to 60 cycles per minute, and hindi po tayo dapat nakakita ng retractions. When we speak of retraction, they are chest wall indrawing, and this may be due to difficulty of breathing. So abnormal finding po ito, and it may mean that there is increased force in pulling in air during inspiration or inhalation. So pag humihinga po yung bata, even the spaces in between their rib cages are already being pulled. So, ibig sabihin, meron siyang parang oxygen hunger. Yung bata po ay sobrang desperate to inhale oxygen, kaya po nagkakaroon siya ng retraction or chest indrawings. Okay? So, maaari po din tayong makarinig ng rhonchi. When we speak of rhonchi, they are harsh sounds of air passing over mucus, and they are due to the presence of secretions on the back of the throat. So that's normal po pag nakakarinig tayo ng rhonchi, because that just means that meron pa siyang secretions on the back of the throat. Ang hindi po natin dapat naririnig is what we call grunting. When we speak of grunting, these are abnormal sounds and they already suggest respiratory distress syndrome. On the next slide, I will show you or let you hear and listen to a video about rhonchi, and the next video will be about grunting, okay, or what we call the respiratory distress syndrome. So please watch out.
Infant distress means your baby is having difficulties. Knowing what to look for will help you know if your baby is in distress. Your baby may have breathing problems, such as retractions, grunting, and apnea. Retractions are unusual breathing movements. With each breath, your baby's chest muscles pull in the skin around the bones. Grunting is a noisy breathing sound. Your baby may grunt to keep air in the lungs. Grunting may sound like snoring or singing. Apnea is a condition in which your baby pauses breathing for 15 to 20 seconds. Then continues breathing. You may notice changes in your baby's skin. Two common findings are conditions known as cyanosis and jaundice. Cyanosis is a blue skin color. You can usually see it around your baby's lips, chest, and stomach. This blue color means that the oxygen level in the blood may be too low. Cyanosis may mean there is a problem with the baby's lungs or heart. Jaundice is an overall yellow skin color. It happens when a substance called bilirubin builds up in the blood. Most babies have some jaundice that appears more than 24 hours after birth. If left untreated, severe or long-lasting jaundice may cause brain damage. It's important to check your baby for these signs of distress. Immediately contact a member of your healthcare team if you notice any of these warning signs.
For that. Let us also assess the abdomen of the neonates. So the abdomen of the neonate is dome in shape. So dapat po pabilog po yan. And the abdomen should not be sunken. So pag nakikita po tayo ng sunken abdomen or yung abdomen niya ay paloob, okay? So that indicates a missing abdominal organ or either diaphragmatic hernia. So maaaring meron siyang walang atay, meron siyang missing na abdominal organs, or pwedeng nag-herniate po yung kanyang abdominal organs into the diaphragm, kaya po sunken or walang laman yung kanyang abdomen kasi lumipat po yung ibang organ niya sa kanyang diaphragm. So that's what we call diaphragmatic hernia. So dalawa lang po ang magiging iisipin natin. If there is a sunken abdomen, it indicates missing abdominal organ or diaphragmatic hernia. So immediately report it to the doctor if you see your patient has sunken abdomen. Now, we also discuss about peristaltic sounds. Pag sinabi po nating peristaltic sounds, ito po yung tinatawag natin na guruod, lumabising ka, guruod dayichan mo. Or these are produced by the movements of the intestines and it is heard within an hour after birth because the baby will already display hunger. Kaya po gagalaw na din yung kanyang mga bituka and because of that movement, magkakaroon po siya ng peristaltic sounds na maproproduce. Alright, we also have your umbilicus. The umbilicus is on the first 24 hours, it appears white and gelatinous. Yung umbilicus natin or your umbilical cord, it is white and gelatinous, and it should also have a red and blue streak with the ava or 2 arteries and 1 vein. Now, you have to inspect the clamp if it is secured kasi nga po, kung hindi secure yung clamp, pwedeng mag-bleeding po doon. So you have to secure or place another clamp below the original clamp that has been placed. Now, the cord dries up and turns to color gray-black and the stump breaks free at 7 to the 10th day. So pwedeng matanggal po yung ating umbilical cord if it is dry in the 7th to the 10th day of life. Now, you also note if there is bleeding at the cord site, so pwedeng magkaroon siya ng loosened or na-loosen lang yung kanyang clamp, and or it may be a tugged cord or pwedeng nahila yung cord na yun kaya nagkakaroon siya ng bleeding at the cord site. Alright, so you also watch out for moist or mamasa-masa, odorous or mabaho na cord because it may suggest infection which may lead to septicemia or what we call tetanus neonatorum. So, maaaring hindi po malinis yung pagkat ng cord sa bata kaya siya natetetanus. So, those may be signs of tetanus neonatorum pag meron siyang moist, odorous cord and it is also hot to touch yung kanyang surrounding area. Alright, so always remember not to put buttons and coins and tapes on the stump because it can also lead to infection. So yun po yung usual practices nila. Naglalagay po sila ng kung ano-ano dyan because of superstitious beliefs. So sabihin po natin, you do not place anything on the cord because we want to air dry it to prevent infection. So yan po yung itsura ng ating cord. It will fall off after 7 to 10 days as long as it is kept dry as much as possible. Now, it's also time for us to check the anogenital area. So, in the anogenital area, we check the anus and the genitals. Now, the anus, the temperature is taken via rectal thermometer to check for the patency of the anal region. So, mag-i-insert po tayo ng anal thermometer doon or rectal thermometer so that we can check if there is an opening on the anal region. So, it is already an antiquated means of checking anal patency kasi hindi na tayo po nag-i-insert ng rectal thermometer just to check for anal patency. Ano po? Because we can just wait for the first 24 hours for meconium to pass. So, pag tumae na po yung bata, ibig sabihin ay meron na po siyang patent na anus. Okay? Pero pag hindi po tumae yung bata on the first 24 hours, that may mean that the child has imperforate anus or the stenosis or membrane formation in the anus and leading to absence of the anal orifice. So, maaaring yung bata po ay wala po siyang butas sa kanyang puwet na pwedeng lumabasan ng kanyang tae. So that's what we call imperforate anus. So the best way to check for that is kung hindi po siya tumae within the first 24 hours, that means that there may be imperforate anus. Okay? So next, we also have to check for the male genitalia. The scrotum, or we have what we call the ball sac, is edematous and rugated and it is deeply pigmented in black and violet in color. So, yung ballsack niya is naturally black and heavily pigmented and rugated. So, para siyang may mga skin folds. I'll show you later. Now, we also have the term cryptorchidism. It is known as the undescended testicles. So, the child will undergo surgery pag hindi po bumaba yung testicles niya. So, you also have to check for the testicles of the child. Dapat po may dalawang testicles yung bata. Kung wala po siyang testicles, report immediately to the doctor because it may be a case of cryptorchidism or hindi pa po nakababa yung kanyang testicles or it may be trapped in the inguinal area. Now, we also have the term cremasteric reflex. So, what we do is we stroke the internal side of the thigh and then the testicles of that specific side will move upward. So that will also check for the spinal cord integrity or the spinal nerve, I should say. So let's look at the imperforate anus. So as you can see here, sa region kung saan dapat meron siyang anal opening ay wala po. So itong case na po ito ay what we call imperforate anus. Alright, so look at the scrotum of the child. It's also pigmented in black and blue and it should also be deeply rugated. So as you can see, meron siyang mga skin folds dito and then it is also deeply colored in black violet. So yan po yung tinatawag natin na scrotum area. We also have what we call cryptorchidism or undescended testicles. So as you can see, no, yung testicles niya hindi pa nakababa kaya yung testicles ay hindi mo makikita sa kanyang ball sac or scrotum. Okay, so once na hindi ka nakakita po or naka-feel ng testicles dito, maaaring they are trapped in the inguinal area. So nandito sila. Ang tawag po natin dyan ay cryptorchidism. We also have what we call cremasteric reflex. So you stroke this side of the thigh, yung kanyang testicle ay tataas. So that means that there is integrity in the spinal nerve. So those are what our assessment should be when we are assessing the ano-genital area. Now, in terms of the penis and the vulva naman po, we also have to check for those regions when we are assessing the neonate. So, the penis of the child will appear small and it will be at most 2 centimeters in length. Now, the urethral meatus should be on the tip of the glans penis. So, dapat po yung ihi ihian ng bata, which is the opening of the glans penis or what we call the urethral meatus, should be on the tip of the glans penis. Pero may mga instances po that there is what we call the epispadias or what we call the meatus, the urethral meatus is in the dorsal surface or doon po sa may mismong taas ng ihian. Meron po tayong tinatawag na hypospadias wherein the meatus is in the ventral surface, kaya po hindi po mismong sa tip of the glans penis nandun yung urethral meatus. I'll show you a picture later on. We also have what we call phimosis or the adhesion of the foreskin. So masyado pong madikit yung foreskin sa glans penis po ng bata, especially if those patients are uncircumcised. Now, if the phimosis or the adhesion of the foreskin, masyadong madikit po yung foreskin sa ulo ng penis ng bata, if it impedes urination, then circumcision is already done para po ma-open yung adhesion na po na yon. Now, when in terms of female genitalia, we have what the vulva, it may appear swollen and there may be secretions of blood-tinged mucus, which may be what we call pseudo-menstruation. So, it may be caused by maternal hormones na pumunta kay baby, kaya na-trigger yung kanyang pseudo-menstruation. So, yun po, normal lang po yun na makakita tayo ng blood-tinged mucus on the vulva of the baby. That just means that there is excess maternal hormones. So this is what we call the epispadias. Dito po, this is what we call the hypospadias. This is the normal placement of the urinary meatus. Okay, so phimosis naman po is masyadong madikit yung foreskin sa glans penis. Okay, it cannot be pulled back. So, yan po ang tawag natin dyan ay phimosis. Kung nakaka-impede po sa kanyang urination, we circumcise the baby. But, kung pwede naman pong ma-expose yung glans penis and the normal foreskin can be retracted back, no need for circumcision. So, yan po yung tinatawag natin na hypospadias, epispadias, and phimosis. Alright, the last area we have to check are the back and the extremities. So when we are assessing the back, it is normal for the newborns to lie flat on their backs when supine, and the spinal curvatures, yung kanyang pag-S ng kanyang spine will only appear when the child already starts to sit. Now, the infant will also assume their position in utero. So, pwedeng naka-fetal position po sila. And the back may be rounded and extremities are flexed on the abdomen and the chest. Now, when we are assessing for the back of the neonate, you have to look for mass or hairy nodules or dimpling because this may indicate spina bifida. Okay, so when we speak of spina bifida, it is an abnormality of the spinal area or the vertebrae. So, maaring may problema po doon pag meron siyang mass, hairy nodule, or dimpling. We also have the extremities. The extremities, upper and lower, should be symmetric. Okay, dapat pantay po sa size, equal length, I should say, and moves in coordination. So, kung paano gumagalaw yung isa, dapat gumagalaw din po yung kabila. Now, the arms assume a flexed position while the feet are bowed, kaya nga po sila naka-fetal position. Pero ang dapat pong abnormality na rin-report natin is polydactylism or the presence of extra fingers or toes. Meron din tayong tinatawag na syndactylism or the fusing of two or more fingers together. Meron din tayong tinatawag na simian crease or the line in our palm, which may be indicative of Down syndrome. So, tawag po natin doon ay simian crease, which is a single crease in the hand. So, yung fold po natin dito sa may kamay, may pag-iisa lang po yan na straight. Ang tawag po doon is simian crease that may be indicative of Down syndrome. We also have what we call Abdomen paralysis, or there's an inability to move the upper extremity due to nerve damage during delivery. So, maaaring deliver yung bata using the shoulder, kaya sing-sing kulto metende jo ubingen. So, ang tawag natin doon ay Abdomen paralysis. So, let's look at the pictures of these different conditions. So, this is what we call spina bifida. So, tinitignan natin yung likod ng bata because there may be a presence of mass, hairy nodules, or dimpling. So, in this case, meron siyang presence of mass. Okay? So, ito po yung tinatawag natin na polydactylism or the presence of extra digits. This is what we call syndactylism or the fusing of two or more digits, fingers or toes. Okay? Ito po yung tinatawag natin na simian crease or simian line. So as you can see, ito po yung normal. Meron tayong dalawa. Okay, at least dalawa na creases on our palms. But dito po sa simian crease natin, nag-iisa lang po siya and it may be indicative of Down syndrome. Meron din po tayong tinatawag na Abdomen paralysis. So maaaring hindi kayang igalaw ng bata yung kanyang upper extremities because of a paralysis of the upper extremities. So agsingsingkul isuna. Ang tawag po natin dyan ay Abdomen paralysis. It is usually used or it usually happens when the midwife delivers the baby while pulling on the armpits. So, pwedeng magkaroon siya ng nerve damage dyan pag hinihila yung bata using the armpits during delivery. Alright, maraming salamat po for listening.
At dyan na po nagtatapos ang ating recorded review para sa nursing at midwifery licensure examinations. Sana po ay marami kayong natutunan sa akin. Muli, ako si Sir Jeffley at sana po ay suportahan nyo ang aking YouTube channel sa pamamagitan ng pag-like, pag-subscribe at pag-share sa aking mga lectures at contents. Lagi nyong tatandaan na kayang-kaya nyong pumasa at mag-top sa board exams. Kailangan nyo lang magtiwala sa inyong sarili upang makamit nyo ang inyong mga inaasam na lisensya. Nawa ay pagpalain kayong lahat. Hanggang sa muli, paalam!